Suspensory ligament release versus Botox injection. What are the expected outcomes in terms of penile elongation? What are the pros and cons? Are there any risks and what are the costs involved? In this video, I will give you some details. My name is Stefan Buntrock and I'm a board-certified urologist and sexologist. Penis is a big topic on UroChannel, but as a urologist, my area of expertise exceeds far beyond that. So if you like my content and are interested to hear more about urological topics, please subscribe. Let me start by pointing out that penile enlargement surgery for cosmetic reasons is not really supported by the guidelines of the urological societies. And besides, real lengthening is not possible for functional reasons. Girth enhancement with fillers is more feasible as functionality doesn't get into the way. I just skip the part about ethics in normally sized men and get right to the point. The easiest surgical procedure to provide the illusion of a longer penis is suspensory ligament release. The penis is anchored at its root to the pubic bone with a firm ligament, and if this ligament is cut, then the penis looks longer because a part from what was hidden in the body will now start to show. A gain of 1 to 3 centimeters will be a realistic outcome. Some websites promise much more than that, but I am rather critical whether this promise can be kept in the majority of patients. However, keep in mind that we are only talking flaccid. Erect length doesn't change. Ligament release comes at a price because in order to gain length, stability is sacrificed. This may cause problems with penetration and sexual intercourse. In one of my former videos, I talked to you about Botox injection for therapy refractory erectile dysfunction as a new emerging therapy. A side effect of Botox is a penile lengthening effect. Now, after doing my homework and researching the subject, I am convinced that Botox has a chance to gain approval for certain forms of erectile dysfunction. But this will take several years, and I don't think that this will happen soon. For the time being, this is strictly off-label, as Botox is not approved for that kind of treatment indication. Recently, I started with this treatment in selected patients. Regarding flaccid penile length, the preliminary results look very promising. It seems Botox is able to achieve the same effects as ligament release, which means a longer flaccid penis, but not a longer erect penis. Should this turn out to be true also for the patients to come, then it could be an excellent alternative to suspensory ligament release because penile stability with erections doesn't get compromised. The procedure consists of injections in one therapy session and not a surgical operation, so it is done within a few minutes. However, as I said, it is off-label for the time being, which has a number of legal implications. So patient selection is an issue, as I wouldn't approve doing it with any patient. Maybe the greatest disadvantage is that Botox wears off after 3 to 6 months and has to be repeated. This may also be regarded as an advantage because should anything adverse happen, if you don't like the outcome, it will disappear all by itself. Botox is also much cheaper than surgery. Prices vary quite a bit, but while surgery costs around $15,000 to $25,000, Botox will cost just a fraction of that. Both procedures are safe in general, but with any medical procedure, side effects are possible. Apart from the usual general risks, wound infection, bleeding, etc., if I were to choose the complication that I would like the least, I'd pick penile shortening and ligament release, which is a possibility in rare cases, and penile deviation in Botox, as injections into the penis always bear a slight risk of scarring with subsequent deviation. Apart from that, the safety profile for both procedures is high. I will keep you informed about my experiences with Botox injections. Thanks for watching. Bye-bye.